Welcome to B'madzaji Ginonindwa. This podcast is produced by the Communications Department at the Anishinaabeg Nation. We will be focusing on the issues and initiatives in Anishinaabeg Nation territory. I'm your host, Lisa Abel. In July 2024, Beausoleil First Nation opened their very own dialysis unit. Also known as Chiminising, Beausoleil First Nation rests on the shores of southern Georgian Bay on the Christian, Beckwith, and Hope Islands. The community is only accessible by ferry. Hemodialysis is a life-sustaining treatment that cleans a person's blood if their kidneys are no longer able to. Diabetes and high blood pressure are the most common causes of chronic kidney disease. According to the Ontario Renal Network, First Nations, Inuit, and Métis people are disproportionately affected by chronic kidney disease and are more likely to travel long distances for treatment. Before dialysis services became available on Christian Island, community members living with chronic kidney disease had to travel 3 times a week by ferry and car to the dialysis site in nearby Midland. Weather and ice conditions can delay or shut down the ferry. Now with the Anwatan Nabi Calming Waters Assisted Care Dialysis right in the community, the total time for travel and treatment is reduced from up to 8 hours to just 3 hours, leading to an improved quality of life. At the Anishinaabeg Nation Health Conference held last October, I met with Deborah Laramie and Dr. Scott Brimble, who shared about how Beausoleil First Nation successfully brought in the dialysis unit to the community, as well as the impacts of chronic kidney disease. Deborah Laramie is the director of the Beausoleil Family Health Center and serves as the board president of the Chigamik Community Health Center in Midland. Dr. Scott Brimble is a nephrologist and researcher who focuses on the management of patients with chronic kidney disease, hypertension, and peritoneal dialysis. He is a staff nephrologist at St. Joseph's Healthcare in Hamilton and Divisional Director of Nephrology in the Department of Medicine at McMaster University. He is also a provincial lead at the Ontario Renal Network. Deborah has seen firsthand how living in an isolated community can impact food security, family budgets, and transportation costs. Dr. Brimble explained how healthcare professionals need to take the time to learn about a First Nations community context and gain trust in order to provide culturally safe care. Welcome, Miigwech, for taking part. I'm here today with Deborah Laramie and Dr. Scott Brimble. So Miigwech for taking part in the podcast today. So would you each like to take a turn introducing yourselves? I guess we'll start with you, Deborah.
Well, as you said, my name is Deborah Laramie. I have been the health director at Beausoleil First Nation for about 6 years now. My history is not in health. My history is in finance, but when you get into health, I think finance ties right into that, so it's worked well. I service a community of approximately 895 residents, year-round residents, and it's been exciting. We've done a lot of amazing things. I have 34 staff, so I have an amazing team surrounding me, and together we've created some great things since I've come on board.
And an interesting part of your community, did I hear you mention it's on an island,
That's
right?
correct. Yes, we have access to our community by ferry. So our lives work around that ferry schedule. And of course, we have things like wind and winter and ice and all those other things thrown in as well to keep our lives interesting. And
So it must take some kind of problem solving to ensure that community members have access to healthcare.
At all times, yeah, at all times. So it's a real collaborative effort between ourselves and the ferry crew, the EMS, the paramedicine, all these different frontline. We worked to make sure that our community is safe and that they have access to the healthcare that they need.
Scott, would you like to introduce yourself?
Sure. So I'm a kidney specialist or nephrologist, and I've been working in Hamilton doing that for the last 23 years, which is hard to imagine. And I've also had the opportunity to work in a provincial role as well at the Ontario Renal Network. So the other kind of connection I have to Indigenous kidney health, so Six Nations First Nation is only about a half an hour away from Hamilton. And for the last 10 years, I've been providing kidney care at the White Pines Family Health Team there, right in the clinic. And then there's also a dialysis unit attached to the Family Health Team on the Six Nations reserve. So I've been seeing dialysis patients there for the past decade or so as well.
In your presentation today, you gave a quick overview of kidney health and then chronic kidney conditions. Can you help our audience kind of understand?
Yeah, it was very abbreviated. So we talked a little bit about what chronic kidney disease is. So we have two kidneys. They're responsible for regulating fluid balance, minerals. They do really quite a variety of things. And so, unfortunately, many people develop kidney disease. Up to 10% of the adult population will develop kidney disease. And the prevalence of kidney disease is much, much higher in First Nations peoples. And there are things we can do to prevent it. The biggest risk factors by far are things like just getting older, having a strong family history of kidney disease, diabetes, and high blood pressure. And so, when I'm seeing patients who have kidney disease, I'm really focusing on, what can we do to help sort of manage those risk factors. And that's going to be a combination of sort of medications, Western medicines, but also lifestyle. And part of the work I've done at going to the family health team is just to provide care closer to home and just develop the relationships and hopefully some trust and collaborating with care providers there to hopefully over time make a difference.
So you definitely have a background working with Indigenous communities.
I do, yes.
Well, Deborah, are you noticing this kind of prevalence of kidney disease in the community at Beausoleil?
I am. We have quite a large number of people who have chronic kidney disease, and unfortunately we've lost a few in the recent months. We do have a on-site doctor who has kind of forewarned me that we do have some people that will be coming forward and utilizing our dialysis services. So it continues. And again, like you said, lifestyle, food, different things like that. I mean, those all play into it. Education, of course, is important, but to travel from our island to town is 40 minutes. Most people travel by taxi, so we're talking $40-$45 one way. So there's $100 right away off your food budget. So being able to make those nutritional choices that we wish we could make, as opposed to the ones that we are having to make, is one of those things that we've kind of come up against as a health center. We do good food boxes, so we do deliver 30 good food boxes weekly to those who are diabetic, so that they have fresh fruit and vegetables. We've recently, we're in the process right now of applying for some funds in order to have year-round greenhouses outside the health center. We have a community garden that my staff and I put together this past year, and it was really, really successful. It was wonderful in seeing our team work together, and a lot of them don't have the gardening experience, and so This was new to them. It was really good for our team to be out there. And it was a nice feeling to be able to package up the things that we had grown and to deliver them to the different elders and different people in the community we knew that were struggling or didn't have gardens of their own. And our hope is to expand on that and be able to offer that year round. So that's the direction we're going to try to kind of start alleviating some of these issues that are putting people in not having the proper nutrition and things like that.
So then it's food security or access to food, and then sustainable food sources has been important.
It is. And a few years ago, I traveled to Iceland and got to see their greenhouses. And this is kind of when I saw this proposal come through, I thought, we could do this. We could do this here on the island. We could have, the solar greenhouses. We could have that fresh fruit and vegetables right here on the island year round. We can do this. And like I said, I have a really strong team behind me in the people that I work with within the health center. And, I just know that this could be something that could expand and be really could become something really viable for the community and pulling the community into it as well. We always like to start things off as a health center initiative, but we gradually hand it off to the community, and the community starts taking ownership and starts looking after those things for themselves. So we just get to kind of lay the groundwork, and this is what we're hoping to do, is lay this groundwork with these different bringing in the fresh fruit and vegetables and different things that we can grow and have the community participate in that.
And that gardening is really such a beautiful experience, right?
It's
It's like it's so reconnecting yourself to the land and to, the cycles of the seasons and everything.
Exactly. And just having the staff work together and do that teamwork and learn about growing, because not everybody gardens, right? So it was a learning experience. It was fun. Once it started going really good, we were like just about every day, please come up to the health center and take these fresh vegetables home. We have tons of them. Come and help yourself. And it was wonderful. It really was,
So people ate their vegetables? Some people don't like their veggies.
But they did. And they came and got it, right? And that's what I'm saying. If we can expand on that and incorporate, bring the community as part of it, bring them on board and gently hand it over to them eventually and say, here you go, you're going to look after yourselves here.
So you're mentioning, the food security is one element that might be impacting First Nations health.
Yeah.
Do you notice any other kind of impacts? Often we use like that social determinants of health approach, right? Like what are you seeing in the community that is impacting the prevalence of kidney disease?
Where do you want me to start?
Really?
Do you want me to start and say, okay, we all need good housing. When we have good housing, we have well-being. So let's start that. Not to say that Bowsley First Nation doesn't have a lot of housing, but as with all First Nations, we're just those few houses short, right? So that would be something, because there's also a need to have a feeling of wellness. And if you're in a situation where you don't have that feeling of wellness, it affects you. Affects what you reach for as your go-to food. It affects, whether you're going to get up and do exercise. It affects whether you're going to leave the house and come and see a nurse or a doctor or, make that appointment or, all these things just all tie into it. So it's a need to put that circle of care around each community member and fill in those gaps. Someone might have their own garden and be able to, or they go moose hunting and they have a moose and they have all the food they need, but they might not have that social, right? So we need to pull them into that circle and say, okay, this person needs to spend more time with other people. They're feeling lonely. They might be sitting eating a good moose steak, but they're doing it by themselves, right? So the idea from the health center, right from the beginning, was that each person deserves a circle of care around them, and that we as a team need to find out where the gaps are in that circle.
Okay, so that's a good approach then. So it's not only looking specifically at one health element. It's kind of looking at the entirety of the person's life. Scott, I'm wondering, with the healthcare profession, are there challenges particular for healthcare professionals coming in to work in First Nations communities, either if it's structural or resources? What kind of things have you observed?
Yeah, I mean, I could say the same thing. Where do you start? For me, I had to learn. Again, a disproportionate number of our patients are from Six Nations. And, we have staff who, frankly, and I would say myself as well, didn't know how to approach providing care to the community members there. And it was a learning experience for me, and it took time to gain trust and to really understand where, when I'm seeing somebody in my clinic, what is their story? What is the background? And I think I fumbled my way through it at first and probably didn't do as good a job as I could. And so then that required going back and okay, I need to educate myself better and learn more about providing culturally safe care to build the trust. I practice Western medicine, but I do think lifestyle is a very important thing. And I have vivid memory of doing a presentation to a community where I'm talking about sort of, dialysis, different types of dialysis. And they're saying we're worried about food security. We're worried about housing, about water. And you're talking to us about this. And that kind of really shook me. And okay, I need to rethink this a bit. And I work in a community that's maybe a bit better off. It's in Southern Ontario. It's not maybe facing the same challenges as some of the more northern communities. But I think just by trying to better understand them as an individual, as a person, as a family, a community, and accept that they may have slightly different views on wellness. I think in the end, we kind of all have the same idea, but I don't know. I think it's just been an experience that takes time. And then I see some of my team members who struggle with it because maybe they haven't taken the time to learn more about the history, about colonialization and the impact on community members. And that's something I think it's a lifelong learning for me. And I hope to continue to get better at it because I think I still have a lot of learning to do.
Yeah, that's important. So, Deborah, I heard that at Beausoleil, the community managed to bring in dialysis services right on the island.
That's correct.
Can you talk about what kind of challenges you may have been facing before and then how you were able to bring this service into your community?
This want for a dialysis unit on the island goes back to previous health directors. I believe from the file I received, the first attempts were in 2017. And when I took over as health director, one of the previous directors came and handed this file to me, and it was almost like tag, that she was passing this on, and she said this is important. So I read through it and spoke to our attending physician that we have on the island, and I don't know who made the first move. I don't know if it was himself or me, but we reached out to Ontario Renal, and we started reviewing some of the previous meetings that had been held and different things that they had been up against, water being one of the biggest one. That was one of the biggest issues. But I mean, since those original meetings, there had been a new water plant and different things that happened with the infrastructure on Beausoleil First Nation. So we kind of just cleared the page and said, okay, let's start looking at what's possible. One of my driving forces was a few years ago, because of the boat and the ice and the weather, one Christmas, I think it was my second year as health director, all of my dialysis patients had to stay in town Christmas Eve and Christmas Day, away from their families. They had to go and get dialysis on the 24th, so we sent them into town to do their dialysis. because the dialysis would be shut down the 25th and 26th. And the wind picked up and the boat shut down. And they spent Christmas away from their families in a hotel. And some of them had young kids, not having mom home for Christmas. I still get emotional about that one. And that really upset me. And so I got a little pushy, got a little louder at meetings, started pushing forward with a little more aggressively that this is possible. Let's make it possible. Let's look at it. Let's turn it upside down, inside out. Let's make this happen. And we had some really good meetings with Ontario Renal and the team that they put together to help make this happen. But I think that really was the driving force, was just knowing that I had community members who were stuck in town away from their kids on Christmas. And that was just awful to me. And so that was the driving force.
That really drove you to action. I'm kind of surprised because when I'm thinking of kidney disease, I'm thinking maybe it's someone who's older. But you're mentioning people had
young kids,
children at home.
Yes.
So it's kind of impacting a wide age range of population too.
On Bosley it is, yes. Mm-hmm. Yes, it is. Mm-hmm. And that was devastating to me. And I can't explain the feeling. It's weather. It's a boat. It's out of control, right?
But it's not something that people accessing healthcare off reserve would have been a challenge they would have been likely to encounter.
Or understand, right? Or understand that, no, they can't get home. If your life isn't tied to a boat and a boat schedule. And I think that's when, like I said, we really started pushing the idea of how do we make this possible? How do we bring it to Bosley and make this happen?
So then what happened after that?
Oh, lots of meetings, lots of back and forth, lots of yes, we cans, and then just recognizing all the different stumbling blocks but when a group of people just have a mindset, there's always someone who knows how to step over that stumbling block. And we just seem to be able to do that. And it was just amazing how everything just kind of started clicking. It just started happening, because, we were dealing with the provincial government and we were dealing with different things, and there was money, and there was how do we get all this equipment over, and everything just, click, click, click. And all of a sudden, there we were on July 16th, opening a brand new dialysis unit on Bosley First Nation.
I'm not sure if you could mention this, but how many community members now are benefiting from having this service there?
So we have 6. Right now we're only doing, because we're just taking baby steps. We're not going to go running around the house with the scissors, right? So right now we're only doing 2. We've hired 2 caregivers who are trained by OSMH. And so they've trained them how to utilize the dialysis machines and work with each person. So we're doing 2 on the island. We still have some that go into town, but that's okay. There's a future here. We're going to get you home. We're going to get you here, So we're training starting on the 28th. I've hired a RPN. So we'll have a nurse caregiver on site. And then we'll transition while she's training. We'll have her train with one of those that are going to town right now. So they will make that relationship, and then they will transition to the island as a team.
And I had the opportunity to go to the opening, and it was a wonderful day. But I did think the whole time going across on the ferry and then hearing, the actual dialysis units, and it's still some travel after that, and it really kind of shook me, oh my goodness, the ordeal, bad weather happens, sometimes the patient's not going to make it to the dialysis unit. But just, thinking about, oh my goodness, what's it like in the winter for these poor patients to have to get back and forth 3 times a week, kind of not knowing what's going to happen each time. And it's a life-sustaining treatment. So it's just a wonderful thing to see the opening.
Yeah.
And then you also mentioned those challenges too, Like some communities might face the challenge of infrastructure. You mentioned like water or...
I think water's the key.
Yeah.
It really is. And like I said, when they sat down originally in 2017, that was the stopgap. And like I said, since then we've had that infrastructure within Bolesley, which allowed us to move ahead. But you're right, there's other First Nations, And I mean, we still have First Nations that don't have clean water. So, I mean, how do we... Yeah. Like there's things that need to be looked at.
Yeah, so it really, these infrastructure things can have a domino effect on a lot of different parts of our health.
Yeah.
But I know you mentioned that you'd like to make sure that other communities know that this is possible.
It is possible. You got to be a little pushy, and you got to make sure that your voice is heard, and you can't be shy about that. Because in my position, when I took my position on, I took it on to look after a community and their health. And this was always one of those bigger things with the travel and the hotels and the missing Christmases and things like that. And it was worth having a loud voice for it. Like I said, Creator's amazing. in my life anyways. And there were nights when... as things started to just gel and move ahead, that I was just like in awe of how well things were coming together. I mean, I'm not saying in the beginning from 2017 to 2023 that there weren't, but these are things that are worth pushing forward for. Technology is another thing, okay? It's not only the water, it's the technology that's happened since 2017 that allows these machines to be brought to isolated communities and remote places. Like, it just amazes me, yeah.
So that wasn't available before? This kind of more portable technology?
Certainly there's been a lot of development in having machines that patients can do in their homes or in a more remote community. So maybe a few less bells and whistle, maybe a little less water requirement. It really has changed. And so there are a number of, newer companies that are out who are providing these machines that are, it used to be, it's just like, there's a hemodialysis machine and it'll be the one that you use wherever you're working. And now there's been this sort of newer focus on being able to do hemodialysis at home or in the home community. It's just designed to be a little bit simpler and more portable, more practical for, because things can happen to them, and the more complicated they are, the more things can go wrong.
That's right.
And then if something goes wrong with it, then it can almost bring upon a crisis, right?
Exactly. And the way they're set up, like our 2 caregivers right now are PSWs. So, I mean, it's not taking an RN or an RPN or that level of health competencies to look after a patient and walk them through dialysis. And the other thing is they're working as a team with the person receiving the dialysis. They're as involved with their treatment as the care person is. So they have some sense of engagement in what's happening to them medically. And that's huge in that sense of perhaps having some say and some control over their health. And I've noticed since we've been doing the dialysis, and one person in particular, since she's been doing it on the island, she comes in the morning and she gets it done and she's out of there and she has a day to do whatever she needs to do. She's not spending an hour on the boat and another 45 minutes into town getting her treatment, another, 45 minutes back to the boat, another half-hour ride. And, they were leaving at 10:30 in the morning and not getting home till 6:37. And that's if the boat was on time.
So that's really disruptive to your lives then.
Yes.
It's disruptive to your livelihood. It's disruptive to your families.
Well, that is their life.
Yeah, that's 3 times a week.
Yeah. So this way, like she's 8:30 in, 1 o'clock out. She's on the island. She's from here to there to go home, and it's changed her life. Like,
Wow. So it sounds like really good reasons for hope then.
yes,
For your community and for other communities that could potentially be taking this on.
yes.
And is that part of the Ontario Renal Network's strategic goals, is to ensure that there's more care within First Nations communities closer to home?
Care closer to home. That's certainly my motto, and absolutely. It may be worth bringing up, so we've been talking about hemodialysis, but there is the other type of dialysis. Peritoneal dialysis is one that's done pretty much exclusively at home. And many patients aren't appropriate for that type of dialysis, but that's another opportunity for patients to be able to do it at home.
Yeah, there just is. Yeah, there is lots of, but it's possible, and that's the message here.
Yeah.
Those long trips back and forth, and your whole day, and the loss of that sense of control over your health, and that's all changed. That's changed with regards to our people on BFN, and other First Nations need to understand that can happen for their people. And those changes can happen too.
Well, is there anything else that each of you would like to share in closing?
Just how impressed I am with the work they've done in Beausoleil. It's truly remarkable. And in my experience, it takes very special individuals to push these things forward. I think as healthcare providers, we want to support and do what we can, but it really comes from the community, and usually very specific community leaders who just want to get something done, and they do it, and you don't get in their way.
And the support from the team, Ontario Renal. And it was nice sitting with a group of people who saw the vision, and we all walked in that direction, and we were successful.
Okay. Well, thank you.
Well, thank you.
Miigwech for taking part. Miigwech for sharing.
Chi-miigwech to Deborah Laramie and Dr. Scott Brimble for taking part in the podcast, and to the Anishinaabeg Nation Health Department for supporting this episode. To learn more about kidney health, find the links in the podcast description. This episode includes the tracks Brothers by Wolf Saga and Chippewa Travelers, and A Very Warm Welcome by Justin Delorme, licensed by Nagamo Publishing. Chi-miigwech for listening to Bamadza Jake and Onindwa. Until next time, Bama P.